We will now show scene 1. This scene takes place in Pakistan during a follow-up visit with a Muslim client who is pregnant with her second child. The HTSP message for this scene is, for the health of the mother and baby, wait at least 2 years before trying to become pregnant again. The scenario begins after the health provider has taken the client's health history and performed the abdominal exam and invited the client's husband to come into the room. Let's listen in to what happens next.
How is your mother doing?
She's doing very well, thank you.
Good. Oh, welcome. Come in, sit down. Thank you, Ibrahim, for coming with your wife to this visit. The reason I asked you to come is so that we can discuss your wife's health with both of you.
Good. I'm very eager to hear what you have to say.
Good. Fatima tells me that your daughter Sadia is doing well.
Yes, thank you. She's very well, alhamdulillah, and growing fast.
Good. That's wonderful to hear. Now, I have examined Fatima and I'm concerned about 2 things. First is that the baby is not growing as it should. And second is that Fatima has khoon ki kami or anemia.
She has khoon ki kami?
I've heard women talk about this. They say that they don't have enough blood in their body.
Yes, that's right. I'm glad you have heard about this, Fatima. Many women in our country have khoon ki kami or anemia. And as you have said, it means that they have less blood in their body. You see, blood is made up of many ingredients. When you have anemia, you have less of the ingredient or part of the blood that gives you energy.
Oh, so my blood does not have enough of this thing that gives me energy?
Yes, that's right. When you have anemia, you do not have enough blood, and so you do not have enough energy. That is why you've been feeling tired, as you told me earlier.
Okay, so this khoon ki kami is what is making me feel more tired.
Yes, that's right. Feeling tired most of the time is a sign of anemia. Now, in order to make more of this kind of blood, it is important to eat foods that have a lot of iron in them, as well as take iron tablets. Here is a guide to foods that have a lot of iron in them. They are foods like ground beef, beef liver, fish, beans, lentils, and green leafy vegetables. Do you know about these?
Yes, in my previous visit to the clinic, the nurse told me to eat such foods as they will help in my health and help the baby grow as well.
Yes, that's right, Fatima. Eating these foods will help you regain your energy as well as help the baby grow. You see, I'm concerned the baby is not growing as well as it should.
Okay, I will eat more.
Good. Please don't hesitate to ask if you have any questions about this at all.
Yes, I will. Thank you.
Ibrahim, one way you can help your wife recover her energy and her health is by making sure that she eats plenty of these foods, as well as by helping her with chores in the home so she can get some rest. Would you do this?
Yes, I will. And I will ask my sister to help as well.
Good, thank you. That will help a great deal. You see, I'm concerned about Fatima's health. She is not as strong as she could be. This is because she became pregnant just 3.5 months after giving birth to the first child. As a result, she did not have enough time to recover from the previous pregnancy and birth before becoming pregnant again. Does this make sense?
Yes, indeed. It makes sense to have time to recover.
Good, I'm glad we agree on this. Do you plan to have any more children after this baby?
Yes, God willing, we would like to have more children.
Yes, we do.
That is fine. I hope you have as many healthy children as you want.
Thank you.
However, women who have closely spaced pregnancies are more likely to have serious health problems during their pregnancy and birth. Therefore, for the sake of Fatima's health and of your future children, I recommend that you wait at least 2 years after the birth of this child before trying to become pregnant again.
Well, I'm sure that this is a good recommendation. However, I'm not sure that we can do this. Is it not God's will when my wife becomes pregnant?
Yes.
And we already have a daughter, but we need a son. If this baby is not a boy, we will need to go for the next one quickly.
Well, I understand your concerns and your desire. Many couples want boys. I'm guessing you want a healthy son, one who can help you when he is older?
Well, yes, of course.
Well, that the best way to ensure that you have a healthy son is to have a healthy mother. So the mother's body needs to be ready for another pregnancy. And the best way to ensure that your wife's body is ready for another pregnancy is by healthy spacing.
Healthy spacing?
Yes, research in many countries, including ours, have shown that if a woman gets pregnant less than 2 years after giving birth, she's more likely to develop serious health problems, have a miscarriage, or the baby can be born too early.
Oh, I see. This can be serious.
Yes, it is also possible that the baby can be born small or of low weight. Now, if a baby is born too early or of low weight, its body cannot fight off diseases. Hence, it gets sick more often and can even develop diarrhea or pneumonia, and we know that can lead to death.
Oh, you know my cousin Khatija. She got pregnant again when her little boy Muhammad was only 4 months old. And then her little girl was born very early and is very sick. Muhammad is always ailing too. Now she's pregnant again and she's very pale.
Yes, that's right, Fatima. That is why healthy spacing is so important. Another benefit of healthy spacing is that you will be able to breastfeed this baby for 2 years, as the Quran recommends.
This is in the Quran? I've not heard this.
Nor have I.
Yes, in the Quran it says mothers should breastfeed their babies for 2 years, and this is good advice. Breastfeeding is very nutritious and it helps protect the baby from many diseases.
I did breastfeed Sadia, but I did not know to do it for 2 years.
Yes, many women don't know about this. Breastfeeding has many advantages for you as well. If you breastfeed for 2 years, you will have enough time to recover from this pregnancy and birth. You will also then be able to replenish your energy and your iron levels will go up. Then you will be ready for the next pregnancy. Does this make sense?
Yes, I see it is important for my wife to have this time to recover. And if the Quran says to breastfeed for 2 years, then this is what we should do.
Yes, I want to do that also, but I'm not sure how can I.
Good. I can help you with that. When you come to a visit at the end of your pregnancy, we can talk about this further. Would that be okay?
Yes, that is fine.
Good, very good. Do you have any other questions at all?
No.
Very good. Please come with Fatima after the baby is born. We can discuss more about breastfeeding and child spacing options then. There are several child spacing methods that do not harm breastfeeding. You can select any option that you like. Is that okay?
Okay, I will.
Excellent. Now, here are your iron pills. Let's talk about how you would take these. You would take one twice a day.
You have just viewed scene 1, in which a provider in Pakistan counsels Fatima, pregnant with her second child, and Fatima's husband, Ibrahim. The HTSP message for this situation is, for the health of the mother and baby, wait at least 2 years before trying to become pregnant again. Let's review highlights of the scene. The provider does several things well in this counseling session. She communicates warmth initially by talking with Ibrahim about his baby girl. She asks just one question at a time and gives Fatima and her husband time to respond. She explains anemia in terms that Fatima and her husband are already familiar with. At times, she addresses Fatima's husband directly to encourage his participation. She acknowledges Ibrahim's role as head of the household by asking him to take care of his wife. The provider emphasizes the need to protect Fatima's health as the reason for spacing the next pregnancy. When Fatima's husband responds that it's God's will when his wife becomes pregnant, the provider tailors her message to his desire for a healthy son. She also reinforces the importance of healthy spacing by citing the Quran's instruction to breastfeed for 2 years. This respects the couple's religious beliefs and also gives her an opportunity to counsel the couple on the benefits of breastfeeding. Finally, the provider uses the phrase child spacing methods, which this couple might find more acceptable than contraceptive methods. By the end of the counseling session, Ibrahim is willing to return to discuss spacing the next pregnancy. This concludes the review of Scene 1. Please use the program menu to view Scene 2 or to select another segment of the program.